that you can move your extremities and you can be in a loaded position without your spine moving. Stable. Is everybody with me? So what is the number one loaded position we're going to be in? Sitting. Sitting loads the spine. So if you have pain with sitting, that means your spine cannot stabilize under a load. Has anybody ever lifted one too many bags of mulch? Or you go over the tipping point. That's a stability issue. Okay, this was me. Okay, this took a lot of time, not a lot of time, this takes a little bit of time, a little bit of training. But the nuance in this is when you do sit-ups, this is not a stability exercise, because what is my spine doing? It is moving. Is everybody with me? That's why sit-ups do not help low back pain or spinal stability, because you're moving your spine. We want to move other stuff and keep our spine neutral, and it's going to be, for some of you in the room, it's going to be a little more difficult than you kind of anticipated, okay? Now, how I'd like to run this class is I'd like you guys to be in a standing position and watch me first, listen to my cues, and then we're all going to do it together, and I'm going to walk around and I'm going to tweak your form to make sure we're doing this properly, okay? So the first exercise we're going to do is, this is part of the McGill Big 3. It's called a curl up. Has anybody done a curl up before? Show of hands. Yep. Okay. So a couple. Awesome. You're going to have one leg up, one down. The leg, this doesn't matter unless you have pain down your leg. So if anybody has sciatica or pain on a leg, you want the leg straight through the leg that has pain. Is everybody with me? If you got pain down both legs, you got to pick the one that hurts the least, or the most. You want the one that the most. And what I'm going to do is I'm going to lay on my back. I'm going to put one hand behind my back, and I want to feel for a neutral spine. A neutral spine is not flat against the floor. It should have a nice 35 to 55 degree curve. So I want to feel an arch. Then I'm going to take a big breath and expand my stomach, and I'm going to feel that with my fingers. I'm going to curl my head up. And hold for 10 seconds. What I'm feeling with this hand is that I have to keep that curve in my back. Is everybody with me? If you lose it, you're not stabilizing your spine. You've now moved your spine and you've lost spinal stability. Anybody have any questions on this? Okay. A couple cues I want you guys to think about. I want your tongue and the roof of your mouth, and we're going to try to breathe through your nose. So watch me again. Hand under my low back. I'm feeling my gut. I'm going to expand it. For a count of 10. Your head does not need to be this far off the ground. It could be this far off the ground. So that's all you're doing, is trying to engage your core by gently lifting off your head. Now, if that gets too easy, there's things where we can lift up your upper body, but we're not there yet. We're just going to lift our head off. Okay? We will do a 10-second hold. With almost all the things we do here with stability, we're going to do a Russian pyramid scheme, which is you would do 5 reps of 10-second holds. Take a break, 3 reps of 10-second holds, and then you're going to finish with 1 rep of a 10-second hold. Does everybody see that? You would do 5, 3, and then 1. What that's going to do, it's going to help us avoid fatigue so we get the neuromuscular re-education deep into the gut. Okay? Everybody on your back. First step, one knee up. One leg straight. One hand behind your low back, doesn't matter which. One hand, I want you to feel the side of your stomach with your fingertips, kind of push in. All together, We're going to take a big breath in and hold it, tongue through the roof of your mouth. Feel your diaphragm expand and gently lift your head.